Good day. My name is Sister Laurie van der Merwe and I am the Diabetes Specialist Nurse Practitioner at the Impangeni Diabetes Center working with Dr. Rebecca Cooper. We're doing these series of short videos to try and help people gain more knowledge about diabetes and perhaps help them in their management of it. For this video, I'm going to be dealing with who is at risk of getting diabetes. And there are certain risk factors that are modifiable, so you can make a change, but there are some things that you cannot change that are genetic and that you are born with that risk for diabetes. Some of those include if your parents have diabetes, so if one parent has it, you have a 40% higher risk of getting type 2 diabetes. If there are both parents have it, then your chances are about 70% that you will be diagnosed with type 2 diabetes. Even a brother or sister, so a sibling, can make you at risk 20 to 30% higher risk of getting diabetes. Other things that do make you at a higher risk is your ethnicity or your race. So Indian families are very much more at risk of getting diabetes, and also your age. If you're over 45 years old, you do have a higher risk of developing diabetes. Some of the other things that we do look for in ladies is if you have had a large baby over 4 kgs or were diagnosed with gestational diabetes, which is the diabetes that one gets when in pregnancy. If you've had gestational before, you've got a 50-50 chance of developing type 2 later in life. Other illnesses that can make you, conditions that can make you more at risk is things like polycystic ovarian syndrome and schizophrenia do make you more at risk of developing diabetes later, as well as certain medications, such as if you are taking the glucocorticosteroids on a chronic basis, so cortisone, on a chronic basis, you are more likely to develop diabetes later. Some of the things that you can work on that do put you at risk are clearly your weight. If you are overweight or obese and have a typically apple-shaped body that we see in diabetes, so a lady with a waist circumference greater than 80 centimeters and a gentleman with a waist circumference greater than 94 centimeters are at risk of developing diabetes. Also, if you are physically inactive, so someone who is not doing any sort of increased activity more than 3 times a week, it's definitely something that puts you more at risk. People with poor dietary habits, so those people who are having diets that are high in saturated fats, high in refined foods, these are more at risk. So takeaways, the high sugar levels of fizzy drinks, these are the things putting you more at risk. Smoking as well increases your risk, and certainly if you have hypertension and hyperlipidemia that is not controlled, these make you more at risk of getting diabetes. Another interesting risk is if you are not sleeping well. So any of the sleep disorders such as sleep apnea, if you are sleeping less than 6 hours of decent sleep a night, you are more at risk of being overweight, and therefore that also increases your risk. So things you can do to change that risk, to reduce it and perhaps hold off the diabetes for a while, is obviously to deal with being overweight. Please don't try and lose lots and lots of weight. Just 5 to 10% weight loss makes a big difference to your body. To try and be a bit more active, so even to just increase your walking to more than 5,000 steps in a day will help. Smoking, if you find it impossible to stop smoking, at least cut down to those cigarettes that you really crave, not the cigarettes that you just smoke because they're there. Controlling your hypertension and hyperlipidemia or cholesterol, as I said, will make a difference. And looking into ways you can get better and longer sleep. So I hope that's of interest to people and of assistance to people. And certainly if you know somebody who's high at risk or a family member who's got a lot of these risks, do start asking them to start testing and trying to modify some of those risk factors. Thank you.